Can prostatitis bacteria become resistant to antibiotics? Imagine battling an infection that just keeps coming back despite treatment. That's what happens when bacteria causing prostatitis become resistant to antibiotics. Bacterial prostatitis is most often caused by bacteria like Escherichia coli, which is common in urinary tract infections. Over time, these bacteria can develop resistance, meaning they change in ways that help them survive even when antibiotics are used. Resistance develops when bacteria are exposed to antibiotics repeatedly or inappropriately. For example, if antibiotics are prescribed without confirming a bacterial infection, or if they are used for too long, bacteria can adapt. Escherichia coli strains that cause prostatitis can become resistant to antibiotics like fluoroquinolones, which have been the main treatment for many years. In some parts of the world, resistance rates to these drugs are as high as 70%, making treatment more difficult. When bacteria become resistant, they can produce enzymes like extended-spectrum beta-lactamases, which break down many antibiotics and render them ineffective. This leads to what is called multidrug-resistant bacteria, which are harder to treat. The overuse and misuse of antibiotics play a big role in this process. Many men receive antibiotics for prostatitis even when it's not confirmed that bacteria are involved, which can promote resistance. The consequences of resistance are serious. Treatments may fail, leading to longer infections and increased discomfort. Doctors might need to prescribe stronger or broader spectrum antibiotics, which can have more side effects and cost more. Sometimes, resistant bacteria are difficult to eliminate completely, which can cause chronic prostatitis or recurrent infections. To manage this problem, healthcare providers emphasize the importance of proper diagnosis. Cultures and sensitivity tests are used to identify the bacteria and determine which antibiotics will work best. This approach helps avoid unnecessary antibiotic use and reduces the risk of resistance. In areas with high resistance rates, doctors may choose different antibiotics from the start based on local patterns. It's also important to understand that resistance can indirectly affect prostate health. If an infection persists due to resistant bacteria, it can cause ongoing inflammation, which might influence prostate function over time. While prostatitis itself is an infection or inflammation, the challenge of resistant bacteria makes treatment more complex. In summary, yes, bacteria causing prostatitis can become resistant to antibiotics. This resistance is a growing concern worldwide, driven by overuse and misuse of antibiotics. To keep treatments effective, it's essential to use antibiotics responsibly, get proper testing, and follow your healthcare provider's advice. Always consult a medical professional for personalized care and guidance on managing prostatitis and its treatment.